Always there. This is a slogan that continues to define the colossal humanitarian work by the Kenya Red Cross Society, which is known to always be the first one in and the last one out during disasters and emergencies. The society has further gained massive respect from the stakeholders, partners, and the general public for its capacity to implement mega development projects aimed at strengthening livelihoods, especially among most vulnerable communities. In all its endeavors, dignified service to humanity is a constant denominator that defines the Kenya Red Cross from the rest.
We want to say that last year has been very successful, and we have been able to have capacity building for our boards at all levels. And I'm very happy that the work done from the grassroots up to the national level, including the regions, is fantastic. All this we attribute to the good governance, which is helping us achieve our policies to be put forward and to be implemented by the Secretariat.
Our focus has always been to alleviate human suffering and save lives. The 2017 drought was severe, and as a society, we were quick on our feet with various mitigation measures aimed at protecting affected families. The Society launched a 2.5 billion Kenyan shilling drought appeal, urgently seeking the help of all Kenyans, partners and stakeholders.
Large part of our intervention was in the area of cash transfer, which was a new thing to do, where communities were registered and given cash. So it's the issue of cash transfers, it was the issue of health and sanitation, it was the issue of water, and issues of nutrition. And then in terms of animal was destocking of animals, buying animal off the pastoralist communities whose animals otherwise would have died, and gave them money, then slaughtered the animal and gave them meat as food. We also did quite a bit in terms of pasture, of buying grass and buying food supplement for the animals, and also vaccinating the animals to keep them healthy. So I would say that really for us, we were the number one organization in responding to the drought, in complementing both county and government efforts, national government efforts in addressing the drought.
Nimepata pesa ya mama yangu, lakini line yangu, lakini nimeshikilia mama yangu. Atasaidia sana. Hiyo nyumba hakuna hata mali. Tuko ndugu yangu mwingine alikuwa mgonjwa, siku nyingine amemaliza mali yote.
Apart from the drought crisis, 2017 has been an electioneering year. A lot of election preparedness and response was witnessed during the August 2017 general elections and October 2017 repeat presidential elections. The Disaster Management Operations Department worked 24/7 responding to violence that occurred in some parts of the country. These included emergency evacuations, first aid services, psychosocial support, family tracing, cash transfers to election victims that lost livelihoods, food distribution, among other support.
Na nimeshukuru zaidi sababu enyewe tulikuwa chini, sababu venye tulichomeka tu mtu alitoka tu na hizo nguo alikuwa amevaa kwa mwili. Kwa hivyo sasa hii pesa itaweza kunisaidia, tajaribu at least ni bai hata kama nikakazi niweke kidogo, at least niweze kupatia watoto wangu chakula.
Other responses were towards cholera mitigation, where we set up 3 cholera treatment centers in Nairobi as part of a multi-agency response to terror attacks in Lamu, and response to fires, especially in schools. The department reached 955,677 direct beneficiaries in the year 2017. In our quest to complement the central and county governments in the area of health, we engaged in multiple projects aimed at ensuring affordable, accessible, and equitable community-based healthcare. As a result, we reached a total of 1,446,644 beneficiaries in the year 2017. Some of the key projects included a catch-up campaign in partnership with UNICEF in 11 counties. The goal was to catch up on poor health indicators caused by the health workers' strike at that time. In entitled immunization, antenatal and postnatal services, nutrition, family planning, treatment of ailments, health education, and referrals of complicated cases. We also complemented the Disaster Management Operations Department by responding swiftly to the cholera outbreak as well as health, nutrition, and gender needs during the drought operation. The year further witnessed malaria outbreak in Marsabit, Turkana, Baringo, Samburu, and West Pokot counties, where we deployed the Kenya Red Cross surge teams to support the counties fight the outbreak.
Because of the vastness of the area Turkana area is so vast, very vast, and majority of people are living in manyatas, in villages, in forests, and those areas are the most affected areas. And currently, because of that factor, we have been doing outreach from day one. We've been doing outreach. We have been sending people outside to manyatas, to affected places like Rahabaricha.
The society continued to scale up in the building of resilient communities with regards to disaster risk reduction, climate change adaptation, food security and livelihood, as well as environment management and restoration. In October 2017, the Kenya Red Cross, in partnership with Kitui County, launched a massive green grams farming project commonly referred to as Dengu Revolution, or Inua Mukulima. The project targeted approximately 200,000 smallholder farmers where 400 metric tons of seeds were distributed. Each farmer received 2 kilograms of seeds projected to produce 90 kilograms after harvest, in an effort to mitigate food insecurity and eradicate poverty in Kitui.
Nilianza kulima hii shamba ya ndengu mwaka huu. Lakini nikaona iko na mabadiliko kubwa. Hizo mbegu zimekuwa mzuri na zikawa kubwa sana. Si vile hapo zamani zilikuwa. Kwa hivyo kupatiwa tingatinga elime hii shamba, nimeona niko na mavuno mengi, natapata mavuno mengi.
With funding from the European Union under the Emergency Trust Fund, we are implementing a 4-year project geared towards increasing peace and stability in Kenya by supporting youth to engage in economic activities. It targets a total of 4,500 young people through livelihood skills and vocational training. Implementation is in 8 counties, namely Mombasa, Kwale, Lamu, Kilifi, Tana River, Garissa, Wajir, and Mandera.
Activity ya kwanza yenye tunafanya na tunaipatia kipaumbele, it's members personal savings, whereby tunahimiza kila mwanachama ajiwekee shilingi 100 kila mwezi, ambayo shilingi 100 itakuwa ni kama share yako katika kile kikundi. Then ikifika mwaka ujao Januari, pesa ama bearing itabadilika, whereby utakuwa na uwezo wa kuweka either 100, either 200, either 500.
Through the Walda Integrated Food Security Project, a total of 200 acres are under farming, where 64 acres of land have been used for planting watermelons, butternuts, and nurseries for onions, kales, and grass. The project goal was to address the plight of the pastoralists who have over time been affected by the drought crisis.
Maisha tunabadilika vizuri juu hiyo wakati tulianza kulima hata hatujitarajia tutapata kitu kama hii. Saizi tuko na moyo ya kufanya kazi na tuko saizi hata kama Marsabit pale mingine yote wako jilali. Saizi hizo tunakula, tuko sawa, tunaendelea vizuri.
In 2017, the department reached 417,531 beneficiaries. The Water and Sanitation Department set out on a journey to make the realization of sustainable development goals both likely and sustainable, endeavoring to ensure availability and sustainable management of water and sanitation for all. Under the Wash in Kenya project, funded by the British Red Cross and respective county governments, we completed the construction of the Sigor water supply system in partnership with the county government of Bomet. It serves more than 61,000 people.
Tunafurahia kwa sababu watoto wetu watapata afya nzuri na tunafurahia sana. Hata tutasambaza maji, hatutakuja kuchota tena kwa mtoni.
Tutafanya irrigation hata kwa mashamba. Tutakuwa tumepata maji safi, ng'ombe hata itakuwa kikinywa maji safi.
The Ganze Bamba pipeline in Kilifi County is another such project under the Wash in Kenya project, serving a total of 106,565 community members by the year 2018. The aim is to cushion residents from consuming unsafe water and walking long distances in search of water. Similar works are in Taita Taveta County.
Huu mradi ni kwamba ulipofika hapa tulishukuru sana kwa sababu tulikuwa tuna matazamio ya kwamba na saa hii tulipoona hili tangi linajengwa hapa tulishukuru sana Mungu, tukasema wakati huu basi ile shida ya maji itakuwa imeondoka. Na sasa tunataka tuone maji yakipita yakienda huko Bamba na kurudi hapa na kupata, tutashukuru sana.
The Water and Sanitation Department reached 657,782 direct beneficiaries in the year 2017. Under the Global Fund program, we won another 3-year term tender as the non-state principal recipient of the Global Fund HIV grant to manage resources under the country's strategic framework for community HIV response. The grant seeks to deliver an HIV-free country by contributing to achieving the Kenya Vision 2030 through universal access to comprehensive HIV prevention, treatment, and care.
Nilianza dawa kama ilikuwa 16. Nilishika mimba, mtoto wangu akakufa. Kurudi kwenye line, nilienda nikaongea tena na CHW wangu. Ndio nikamuuliza, anikatie shauri vile naweza fanya. Sasa yeye ndiye alikuja akaongea na mimi, akaniambia ni adhere to my drugs. Sasa nikaanza kumeza hizi madawa zangu vizuri. Hali yangu ikarudi ikaanza kuwa vizuri. Sasa mimi pia nilikuwa naendelea vizuri. Sasa sikuona ubaya wote.
In this new grant, the program has grown in depth and breadth. The intent is to improve program quality by enhancing the quality of services by offering a more comprehensive package of services to beneficiaries.
Sana kama mayouth, upande wa kutupima, kama mimi niko laini na naenda kupimwa na wametushauri, kuna madam pale daktari ametufundisha, ametuambia kuhusu jinsi ambavyo tunastahili kutumia mpira.
In the year 2017, the department reached 616,673 beneficiaries. Organization development was centrally placed as the backbone of the Kenya Red Cross Society to ensure the National Society remains relevant to communities and the country. It achieves through a solid network of 64 branches and more than 110,000 volunteers. The department played host to the International Youth Camp where Red Cross youth members from 18 countries were represented. It provides young volunteers from the International Federation of the Red Cross and the Red Crescent an opportunity to meet and exchange ideas, best practices on humanitarian values and work, cultural experiences, talents, innovation, and
And I'm really thankful to the Kenya Red Cross for inviting us here in this beautiful location near Mount Kenya for such an interesting event where we had the chance to share so many opportunities and best practice along the movement of the Red Cross Red Crescent.
The department also implemented the Economic Security Project in Lamu and Tana River counties, where beneficiaries receive Kenyan shillings 27,500 every month for 3 months through cash transfer.
Naitwa Ani Mwangi. Mimi ni mwadhirika wakati wa 015. Wakati wa bwanangu aliuawa, kusema kweli tulipokaa tulisaidia na watu wa Red Cross. Tulipewa pesa kama kila mtu 70,000 na hakika mimi nikaanza kabiashara kadogo haka unakaona, lakini kwa saa hii nashukuru Mungu kwa sababu hata nimeweka bati, hakika hata nimeendelea, kabanda kameshona. Mungu ni mwema, vile mlivyofanya Mungu asaidie.
In 2017, the organizational department reached 59,555 beneficiaries. The achievements could not have been fully realized without the hard-working and committed network of staff and volunteers. The exceeding support from our partners, both locally and internationally, further ensured we achieve our objectives set out earlier in the year. We have no doubt of moving to greater heights in 2018 as we serve and transform communities around us.
We want to be the first humanitarian actor in every emergency in this country. We also want to engage with communities that are perennially faced by emergencies to try and work with them over time and long term to address those risk factors that we can mitigate and make them more resilient than they have been so far.